Sickle cell anemia is a disease that is mostly common in Nyanza and Western. It is a blood disorder that involves a blood component. In Karobangi, a victim of a sickle cell anemia named Rachel explains how she has been coping up with the disease.
Sickle cell ni shida ya damu. Kwanza nikiwa kama nasa inakuwa curved. Sasa ikikuwa mama kwa joint mahali zao ni fruits na vegetables, mboga mingi na matunda mingi sana.
I managed to speak to her mom and explained how her daughter's situation affects her daily activities. She explained on how they spend a lot of money on her medication.
Kenyatta wana deal na hiyo ugonjwa. Kenyatta ndio ina deal na hiyo ugonjwa. Lakini Kenyatta is too expensive kama mkono yako haitafikia. Mimi nilikuwa napeleka Kenyatta nikashindwa juu siwezi kumaintain. Hiyo pesa inatolewa Kenyatta itabidi huyo watoto wakufe kwa sababu ya pesa. Sasa Baraka ni kama hata wanasaidiwa bure.
She explained on how they spend a lot of money on her medication. A doctor explains how sickle cell anemia is inherited through blood and how the affected patient should be treated and handled.
Sickle cell anemia is a medical disorder, and specifically a blood disorder that involves, you understand, in blood components. We have different types of cells, red blood cells, white blood cells, and some platelets, things to do it. So, but specifically for sickle cell anemia, it's whereby red blood cells, normally they're supposed to be like concave in shape, but in sickle cell anemia, they tend to have a sickle cell shape. You understand by the shape of a sickle cell, of how a sickle cell looks like. So a person with sickle cell anemia, his or her blood cells, specifically red blood cells, tends to have, or those patients have a sickle cell. Normally, the main causative for the disease, it's mainly hereditary, whereby genes that exhibit those sickle cell shaped red blood cells are transmitted from generation to generation. So it is a hereditary disorder. The main causative for the disease, it's mainly hereditary, whereby genes that exhibit those sickle cell shaped red blood cells are transmitted from generation to generation. So it is a hereditary disorder. Challenges include of how the disease presents. You know, normally as per se, if I may talk of pathophysiology of the disease, there are usually aggravating factors to the disease mainly, and we have a crisis. If a child is affected with the disease or have some issues to do with infection and dehydration, those are the mainly aggravating factors, whereby when the aggravating factors induces the sickle cell shaped, what happens normally,